I first realised I had fibroids around 10, 12 years ago. My periods were very heavy and I was suffering quite a lot of pain as well. In between my periods, I would bleed as well, so that caused problems with everything I did in everyday life. Going to the gym, walking down the street, even in the car, driving, I just couldn't plan anything. The day-to-day management strategies I had for the fibroids it was almost like having a child again. I had to have a big bag with me, with a change of clothes, with different pads, with a towel. If ever I went out in the car, it was always a towel. And inevitably, I would have to stop and get changed and start all over again during the course of the day. I drove into Manchester once to pick my daughter up from Manchester at uni, and it's a 25-minute journey. And the first time I really bled, I was just aware that I was sat in the seat and I thought, what is happening? I could just feel blood and didn't know what it was. I didn't have any pain. I wasn't on my period. If I actually think back now, I did put my life on hold and didn't do a lot of things that I should have done that I enjoyed doing. I had so many things going on before that time in my life that dealing with them really wasn't an option for me at the time. I was a carer for my mum as well, a full-time carer. I have a son who at the time was struggling with ADHD. I decided enough was enough, that I was fed up of just dealing with the fibroids and the manifestations of them, and ultimately I was referred to St Mary's Hospital. When I first met with a consultant and he gave me options of treatment, one of them was a hysterectomy, which for me wasn't an option. I had too much going on in my life and I didn't have anyone to look after the people I look after or to look after me for the downtime to be out. So when he mentioned Sonata, it was just like a blessing. It was minimally invasive, very little downtime after, and it was as a day case and I was wide awake. So to me, yeah, it was absolutely, let's go for this. After I'd had the treatment, I was really shocked that I could just get up and walk out. My periods now are virtually non-existent. I don't even know when they are. They're very light, a couple of days, and I don't have any bleeding in between. It's just great. Since having the Sonata treatment, I can do what I want to do. I find like I've actually got my life back.
This testimonial reflects the real-life experience of the patient. In a clinical study, 86% of patients reported an average of 40% reduction in heavy menstrual bleeding at 3 months. Common side effects may include bleeding, spotting, cramping or discharge. There are potential risks with this treatment, such as skin burn and infection. Patients who are pregnant, have a pelvic infection, are known to have gynecologic cancer or have intratubal implants for sterilisation should not have this procedure.